Assalamu alaikum. The long clinical consultation day. First scenario, Mrs. Mariam Ahmed, 43 years old, present with a speech problem. Please take history, examine her, address her concern. Ready, Dr. Aisha?
Yes, sir. I'm
Oh,
ready.
okay. Here you go.
Okay. Hello there. I'm Dr. Rizwana Aisha, one of the medical doctors here at the clinic today. Are you Mrs. Mariam, 43
Yes,
years old?
doctor. Yes,
Um,
doctor.
Mrs. Mariam, today we are here to talk about your medical problem. I will be examining you and addressing your concern. Is that all right with you?
Okay, doctor.
So, Mrs. Mariam, could you please tell me what brings you at the clinic today?
Doctor, I have been having problem with my speech, doctor.
Mm-hmm.
Yeah.
And what kind of problem? Can you tell me more in detail?
And I noticed that my speech has become slurred for the past
Mm-hmm.
3 days now.
It's from and it did it happen before, or this is the first time that this happened?
Doctor, this is the first time that it happens. It has never happened to me before.
I'm very sorry to hear that. So and you said that it started 3 days before.
Yes, 3 days ago, doctor.
Okay, and is it the same? Like, did it started the same way, or is it getting worse now?
Actually, it has been like that for the past 3 days, doctor. I don't know. I
Mm-hmm.
don't know.
And is there anything that is making it worse?
Doctor, I can't really say. I can't see. I can't see.
Okay. Have you tried to do something that was making it better?
Mm, doctor, I don't know. I've tried to take some water, yet
Mm-hmm.
it didn't get better. Nothing.
Nothing.
Yeah,
Uh,
yeah.
I'm very sorry to hear. Have you noticed that anything else along with along with this speech problem? Have you noticed anything else like weakness in your body um, or or headache or
Yes,
any?
yes,
Yeah,
yes,
yeah,
doctor. Yes,
yeah.
I've noticed weakness in my body. Yes, doctor. And
Could
yes,
could you tell me where have you noticed weakness? What side of
and
the body?
both in my hand, my right hand and
Hmm.
my right leg, doctor.
Right hand and right
Yes.
leg. Yeah. Have you because of this weakness, did you fall down or did you get any hurt?
Not at all. Not at all, doctor.
Before this incident that the speech was slurred, did you have any fall or something? Ha-
No, 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 doctor. I didn't.
No. Okay. And did you feel any changes in your eyesight or something?
Not at all, doctor. No, I can see very well.
Hmm. Okay. I- um, Mrs. Mariam, could you please tell me, like, are you taking any medications over the counter? Did you try any medications over the counter to help you with this?
No, not at all. It's no, not at all. Not at all.
No. What is your past medical history that I should be aware of?
And doctor, I have high blood pressure, doctor, and which
And since when?
I think for the past 3 years now. Yeah, 3 years. Yeah,
Uh,
and yeah,
and what are you taking for it?
I take amlodipine, but and I've not
Mm-hmm.
been so. Yeah, amlodipine. Yeah.
And you take your medications regularly?
Not at all, because I noticed that whenever I take it, I do have this. I do have headache, so I feel that most likely it's maybe due to the. So I have not been taking it,
Mm-hmm.
religiously. Yeah.
Uh, Mrs. Mariam, I would advise you to take your medications for your blood pressure regularly because you see, the high blood pressure um, uh, comes with no symptoms, but it comes with grave, big problems. Like it can actually cause a big problem for you when the blood pressure is high. It can affect your brain. It can affect your kidney. It can affect your heart. So, and you're quite young, and I must say that you should take your medications regularly. Did you talk to your doctor about this medication and you're not feeling well? Maybe the doctor could have changed the medication.
I haven't. I spoke to him, but he was saying that I should come back later. But I just feel that I'm not set up for that, doctor.
Mrs. Mariam, do you want me to make an appointment with the doctor so that you can go and check once more about it?
No,
How does that
no
sound?
problem. Yeah, it's okay. It's okay.
Oh,
It's okay.
all right, Mrs. Mariam. Any over-the-counter medications that you have taken?
No, not at all. No.
Any past medical surgeries or any falls?
No force. No surgery. No surgery.
Are you allergic to anything? Any medications?
No, doctor.
Mrs. Mariam, I will ask some personal questions. This will be between the medical team and you. So be assured that it is all confidential. Do you smoke?
No, I don't.
Do you drink alcohol?
Yeah, I do.
And how much do you drink?
Occasionally, just every Friday. Sometimes I go for party. I drink occasionally. Yeah, but not much. Just
Any
occasionally.
binge drinking?
No, doctor.
Any recreational drugs?
No.
Are you sexually active?
Yes, I am. Yeah.
And you have a single partner?
Yes, I'm married. Yeah, I'm married.
Any occasional partners?
No.
Oh, all right. Mrs. Mariam, are you taking any OCP contraceptive pills?
No, doctor.
Have you been pregnant?
Yes,
before?
I have. Yes.
How many kids do you have?
I have just one. I have just one.
Okay. I have to ask this question. Did you have any abortions in past?
No.
Okay, perfect. Okay, what do you do for your living?
Actually, I'm a teacher.
And how is this condition affecting you?
Doctor, I can't, as you can see, my voice is not very clear.
I agree.
So, yeah.
Yeah, I can hardly imagine.
Struggling. Yeah.
Yes, we do have social workers, who can help you out with this, if you need help. How does it sound?
Yeah, that sounds good. Thank you, doctor.
How is your mood these days, from past 3 days,
My
especially?
mood has been, well, it has not been good. I'm just sad because, I can't do my normal activities again.
I'm very sorry to hear that. Do you sleep? How is your sleep pattern?
Good. I sleep well. I do.
Did you travel anywhere recently?
Not recently, but I traveled, that was a long time ago. Yeah.
Okay. So, Mrs. Mariam, I will be examining you. And while examination, I will ask some things if I have forgotten in the history. Is that all right with you?
Okay, doctor.
Okay, I will take a step back, wash my hands, and I'll take a step back and look at the general thing. Any scars, any tattooing, any atrophy?
No scars. Is this where do you want to look? Sorry.
Everywhere, like the lower limbs, and
okay.
I will be properly.
I've sent the lower limbs to Dr. Bazin. The legs, in case you want to see them.
Yeah, I will be asking the appropriate exposure for the chest. Okay. So anything on the chest from, I will ask the patient to cough.
Okay, the chest is clear.
Okay, so I will start with a lower limb examination because the patient said that, I feel weak on the right side. So on the right, I will start examining the tone of the leg, in the limb, the knee and hip.
Okay, the tone is reduced in the right side.
The picture is shared, okay?
But sir, the chat box?
Yeah. Sorry, the tone is increased.
The chat box, yes.
Yeah, the tone is increased,
The tone is increased?
Yeah.
Okay. The power?
The power is reduced, 3/5.
Okay.
3/5.
Reflexes?
Reflexes are, there's high reflexes,
okay.
hyper reflex, yeah.
Okay, hyperreflexia. At coordination, I will ask the patient to heel to shin, or mostly on the right side. I will try because it's a um,
Yeah,
heel to
coordination is
shin
intact.
test.
Normal.
Heel to shin is intact.
Yeah, intact. Yeah.
Okay, and sensation. The pinprick, I will just check the pinprick.
Yeah, pinprick are intact. Normal.
Okay, normal. And I will check for the positioning. Is it normal?
Positioning. Yeah, normal.
Yeah, normal.
Yes.
Okay, okay. Vascular. Oh, okay. Then I will be going up and looking for the. Um, got confused. Now I will start with the eye. Is there any eye changes?
Yes,
Vision.
there's a what you want to see in the eyes.
I will start with the movement of the eye.
Movement is normal. Normal movement.
Visual
No
acuity.
problem. Normal.
Field.
Field is also normal.
I would like to check the fundoscope using ophthalmoscope or
Okay, this
fundoscope.
is the fundoscopy. I'm sending the fundoscopy to Dr. Bazin.
Okay. Then I will check the 3, 4, and 6th cranial nerve.
Okay. No,
Any
normal.
nystagmus?
No nystagmus.
Okay. Then I will be checking the any lymph nodes.
Lymph nodes, no lymph nodes.
Oh no, I have to check the other cranial nerves. That is the 5th, 7th, and 5th cranial nerve. I'll be checking the trigeminal.
Okay, there's cranial nerve 7 palsy.
Yeah, facial nerve. Yeah.
Yeah.
Okay, 7th.
There's facial nerve palsy, upper motor neuron
Okay.
type.
Bilateral.
No, just one.
Up,
Yeah.
upper.
Left
Which side?
left cranial nerve palsy.
Okay. Left cranial nerve palsy. Okay. And yeah, it's the upper motor. The forehead is spared,
Yeah,
right?
upper motor neuron
Okay.
type. Yeah.
Okay.
Yeah.
Okay. Fine. Now I'll be checking the gag reflex, that is 9th and 10th. 9th cranial nerve.
Normal.
Open your mouth, please. Could you please open your mouth and
Okay.
say ah? To see the uvula is okay in midline.
Is okay. Yeah, is okay.
Okay. Could you please stick out your tongue and move it from right to left?
Okay.
So it's okay. Any hypertrophy or any fasciculation that I should be noticing?
No. Normal.
Okay. Okay. Then I will go for peripheral examination. Again, I will be checking the upper limb. The upper limb is the same as the lower limb, right?
Yes, the upper limb is the same as the lower limb. Yeah.
Okay. So hypertonia, power is reduced. There is there is increased reflexes. Okay.
Yes.
Then I will go for the lung examination. Chest expansion is okay.
Chest expansion is normal.
Okay. I will check the heart. S1, S2 murmur.
Murmurs S1, S2 murmurs are normal. 1 and 2.
No murmurs, no extra sounds.
No murmurs. Yeah.
Okay. I'll be checking for any bruise.
Bruise, no bruise.
Okay. Checking for the thyroid.
Thyroid is normal.
Okay. So I'll be checking the abdomen.
2 minutes left.
Abdomen is normal.
Any splenomegaly, liver, or palatable kidney?
The spleen is normal. Kidney not palatable. Liver is normal.
Okay, Mrs. Mariam, could you please tell me what is your concern?
Doctor, what do I have? What is causing this my speech problem and my body weakness?
Yes, Mrs. Mariam, I see this is concerning as well. I will try to answer your concerns. This problem looks like you have some inflammation. You have some immune hyper. Your immune system is very active, and it is trying to vasculitis. There is your immune system is very active, which is causing which the background can be anything. It can be infection, or it can be it can be your own immune system for no specific reason. which is causing the blood to clot. And this blood has a clot in your one of the vessels in your brain. Are you following me?
Yes, doctor.
But for sure, to get the correct diagnosis, this is one of the probable diagnosis, which I think, looking at the history and the physical examination. But there are many explanation for your condition, for which to come out to the diagnosis. I will be doing some workup. I will be doing some workup and some imagings. And once we get the reports, we will make a follow-up appointment with you and take the management plan from there. How does that sound?
Okay, that sounds nice. Thank you very much, doctor.
Before I
appreciate it.
finish, do you drive?
Yes, doctor, I drive.
I would say, Mrs. Mariam, you should stop driving until we get the reports done. Is that all right with you?
Okay, doctor. Thank you, doctor.
Is there anything else that I should?
Okay, time's
No.
up.
Okay.
Yes,
Okay.
exam question.
And can you present the positive findings of your patient?
Okay. My patient presents with my patient is 43 years old, female, Mariam. She presented with a symptom of slurred speech from past 3 days. During examination, I got the positive finding of a right-sided weakness, which shows the upper motor neuron type of lesion, which included increased tone, reduced power, reflexes were gone, and the seventh cranial nerve on the left side showed sparing of the forehead. Looking at the condition, I feel that the patient had a stroke.
Okay.
One of my differentials would be the stroke or vasculitis. It could be an infectious reason as well. Though it could be an infectious reason. Yeah.
So what's your differential diagnosis, other differential diagnosis?
So my differential diagnosis would be stroke, vasculitis.
One is, you said, is stroke. Number two, vasculitis.
Cryoglobulinemia, yes, cryoglobulinemia.
Cryoglobulinemia, okay.
Yes, it's also vasculitis, yeah.
Okay.
And maybe some space-occupying lesion, which could cause, or a hypercoagulable state, which could cause.
Okay, space-occupying lesion. Or coagulable states. Okay.
Yes.
Okay. Okay. How will you investigate your patient?
From the bedside, I will be doing the blood pressure, because the patient has high blood pressure and she is incompliant.
Okay.
Then I will be doing the non-specific workup, that is CBC, ESR, full blood count, renal function test, liver function test, metabolic panels of a vitamin B12, a thyroid function test, most importantly. And then I will be doing the imaging test, of course, of the brain. And we start with a CT and followed by the MRI. Already the symptoms have 3 days passed, so MRI could be like the first imaging that I would do, because 48 hours have already been passed if I suspect a stroke. The other specific imaging, because I think it's a cryoglobulinemia, then I could think of vasculitis type of autoimmune panel workup, ANCA positive, IgM and IgG levels for IgM for the cryoglobulinemia, hepatitis, background history of hepatitis, B and C for the infectious cause. I think.
Okay. So
yes.
How will you manage this patient?
We will manage this patient with the multidisciplinary team. I will be involving the neurologist. I'll be involving the radiologist, of course, for the imagings, and for the treatment as well, specialized nurse. I will be involving the physiotherapist and occupational therapist because the speech is impaired, and the patient is coming with a problem. The social worker will be involved as she's having difficulty with the lifestyle, and I think yeah.
Okay.
Okay.
All right. Thank you very much. It was a good one. You
Yeah.
know, you went systematic.
She,
You know.
any pharmacological option, Dr. Henry? Wait, there is 30
yes.
seconds.
Yeah. Yes.
Okay.
Yes. Yeah, pharmacological. I just completely blown out. Yeah. The pharmacologically, I would use the blood thinner anticoagulation therapy would be started if it is an embolic stroke. If it's a hemorrhagic stroke, we will try to see if the blood pressure is the reason. So we'll try to control the blood pressure by giving the IV drugs for lowering down the blood pressure, and then we can taper it down to the oral drugs. And if a retraction is possible, then we can use the surgical retraction for the emboli, I think.
Okay.
Yes. Is there?
Thank you so much, Dr. Aisha. That was a good one.
Thank
Dr. Henry, wait, I want to ask here about very important team in this scenario.
Okay. Okay.
You mentioned multidisciplinary team and the patient present with speech problem.
Yeah. Yes, sir.
So who's the important team to call?
I said the speech therapist and
You mentioned? Okay.
Yes, sir. Yes, sir.
Okay, perfect. Okay, Dr. Henry can comment now.
Okay.
Yes, doctor.
Yeah. Thank you so much. How was it first? How was it first of all? How was it basically?
I don't know. I was just too nervous still. Like,
I understand. It is like that, you know, especially in this kind of case.
Yeah.
Typically, you did very well, to be candid. You tried. You were able to
Thanks,
rule out
Doctor.
certain differential diagnosis of the likely cause of the stroke in these patients, basically. These patients presented with slurring of speech, weakness of one side. You know, first of all, I think when you got that history, you should have asked the handedness of the patient.
Dexterity,
the dexterity, basically. I like the way you asked about the visual symptoms, which is also good in this case. You know, the patient still in the history, you asked about the OCPs, which is good. You asked about the pregnancy, abortion, which is good.
Thank you, Dr.
But you should,
Dr. Basim, actually.
you should have go ahead to also talk about, you know, he has one child. Has he had any, you know, how, you know, asked about the pregnancy history.
I did. Was there any abortion?
No abortion, but he has had 2, you know, early what do you call it again? Early births. You know, he has had early third trimester birth. You know, he had two previous preeclampsia, and he was able to deliver in the first 2 child who eventually died in the ICU, in the intensive care unit. You know, those ones, so he delivered them at 33 weeks. The other one has 33, 12 months, 33 weeks and 32 weeks. Following preeclampsia. But you know, what you asked was abortion. Those are not abortion, but they are what she gave birth to those.
Yeah, it was the loss, pregnancy loss.
So pregnancy loss. No, they were not really lost per se. She delivered them, but we are premature child eventually, and eventually died eventually because they could not, you know, resuscitate them. Now you saw it could have issue of your systemic review was not okay. That was where you have issue. If not, as we ask issue of rash.
The time.
Yeah, the time. Yeah, you saw the legs. He has levodo lenticularis on the legs.
Yeah.
You know, you have issue of, you know, he said he has traveled recently. He said no, he hasn't traveled recently, but he has traveled before. And when he traveled before, he had, you know, a leg swelling and eventually, which is DVT, and that was a long time ago. But he could not really ask about that. I said, yes, I've not traveled recently, but I've traveled time past previously. And then I also mentioned about headache. He just threw away the headache. He didn't ask more about the headache.
Yeah, I didn't notice you said headache.
I said, you know, the reason why I stopped taking the amlodipine was because of the headache.
Because of the
So
headache and
you could not really, this person might be having, intracranial space occupying lesion causing the stroke because of the persistent headache that he has been having currently. But you didn't really, that's the differential diagnosis here, but you didn't really throw more light in that.
because I thought it is the drug that is causing the headache.
You thought, but you could have, you could have asked me about the headache. How's the headache like? The associated symptoms of the headache.
Okay.
By and
Okay.
large. You got the diagnosis was stroke, no doubt. It is stroke. But the likely differential cause of this stroke, it could be due to the antiphospholipid syndrome that he has.
Yeah, Apla. I was thinking about when I saw this vasculitis, that's why the abortion was.
Yes, beautiful.
Yeah.
It could be because of the hypertension. You can see they have some changes in the eyes in the fundoscopy. They have some hypertensive retinopathy. It could be due to the high blood pressure.
Hypertension, yes.
Hypertension that is causing the stroke, basically. It could also be to probably he has, like I said, the headache. Maybe he didn't have anything about it that he didn't probably rule out the ICSO in this patient, which also a differential diagnosis in this case. That is that. Then in the examination, you did not examine the blood pressure, although you should have asked for it. You said it. You should have asked for the blood pressure. I would have told you that how high the blood pressure is, and that would have probably affect your management.
Okay.
You should have asked. Okay, I would have told you that probably the BP is 150 or 160, but you didn't ask.
Yeah. Okay. I should ask about the BP.
You should have asked. Yes. If when you are doing the examination, you should have asked for the BP and checked for the BP. Basically. That would be a clue. Not doing the investigation. You mentioned that, yes, doing investigation as a bedside observation. Yes, but you should have come earlier. That is that. And also, like you said, your investigation too, you didn't talk about the antibodies that are associated, because you need to get the laboratory findings. The lupus anticoagulants, your cardiolipin, your beta 2, those are things that will help you to confirm, to see using the criteria if it is true.
I said in non-specific way, that I will be checking for any autoimmune vasculitic markers. Okay, I should in specifics.
Yes, when you didn't talk about the slurring of speech, you didn't ask, was it sudden or was it gradual? You did not ask if it was sudden in onset.
I said how was it? When did it started from past? And was it like?
Well, I don't know, Dr. Basim, did she ask about if it's sudden in onset? I didn't hear that.
Yeah, she asked 3 days ago.
Yeah, I said 3 days ago, but what? Was it the onset? Was it sudden? Was it gradual?
Yeah, she asked.
What was my response? What was my response? That's a sudden in onset?
Yeah, it started 3 days ago. That's what you said, and
she asked also how was it? Is it same?
Is it getting
any
worse? Yes.
Okay. What I'm saying in a sense is that,
so what do you expect? Like what was the what would be your answer then if it was?
Because no, it was sudden, but it hasn't changed. It has been like that.
Yeah, you said that suddenly. Also. You did say that. No, it has not changed. It has stayed like this from the time. Yes.
So it was sudden in onset. The patient noticed it when he wakes up from it. It was sudden, and it has been there. The weakness also noticed the same weakness too. So basically, that is that. So the patient has stroke, very, very correct, which is like to be an ischemic stroke in this case. Like it could be due to the high blood pressure, which is number one likely cause of the stroke. It could also be due to the underlying antiphospholipid syndrome.
APLA, and antiphospholipid syndrome. Yes.
So basically, and then also it could also be due to the although which is unlikely, but you have to rule it out. Intracranial space occupying lesion can cause similar problem to mimic other stroke.
What did you say, Dr. Henry?
Intracranial space occupying lesion.
Space occupying lesion. Yes, I did say that any space like occupying lesion could also cause the same problem.
You mentioned it beautiful. So these are the thing, but just your major drawback here is just the systemic review was not thorough. Your systemic review was null and void. That is where I think if not outside that you did very well basically. And then for investigation, Did you
Mm-hmm.
mention echo? Did you mention echo?
Oh gosh,
I
yeah.
don't know.
Because
Did you
I
mention,
checked the
yeah,
cardiac. I knew
echo?
that,
Yeah,
it can go
ECG.
through
Yeah,
PFO or,
yes,
yeah,
yes.
yeah. Yeah.
It could
I
be,
just,
yeah.
yeah. The reason I went for the auscultation to the chest because I knew that the stroke can go from the heart, and that was there in my head. I just couldn't in the, yeah, echo.
Basically, yeah. Echo
Yes,
is just X-ray, ECG. You mentioned
yes.
carotid Doppler. Carotid Doppler too, beautiful.
Mm.
Even in the absence of he didn't percuss, he didn't listen to anything. Yes, but as part of the as woke up for stroke, basically,
Doc-
these are the things you need
Dr.
to.
Henry, no time. There was no time. I mean, I
I
just
understand.
couldn't
I do.
pull out.
I understand. I understand.
Yeah,
Exam can go. It can go. It can go like that. It can go like
yeah,
that. But
yeah,
definitely, you did very well. Thank you, Dr.
yeah.
Bazin. Thank you, Dr. Aisha.
You're welcome, Dr.
Thank you.
Henry. Yes, Dr.
Thank
Basim.
you.
Okay. Can you post your scenario first before starting my
Oh, I
comments?
should post, yeah?
Yeah, please.
Yes, yes, sir.
So the first comment, I wrote it in the chat box, the systemic review. What's the importance of systemic review in this scenario? You might miss the cardiac causes
E-
by asking any awareness of heartbeat. Let's start from the CNS. The CNS, one of the relevant system here, because
mm,
this is a speech neurological complaint. So it's very important to ask about the other questions like headache, any hearing issue, any smelling issue,
e-
any change of the facial expression. Okay, weakness and numbness, as you ask about the weakness, but also consider tingling and numbness sensation. Because
okay.
again, it's a stroke possibility. So you have to
Mhm.
ask about these things.
Uh,
Difficult
uh,
swallowing as well.
yes. Yeah, sir, I went to all the cranial nerves, like I asked him, like,
Yes,
is
in the
there any?
examination, but be sure that you cannot cover all of them in the examination, in the exam.
Okay,
Why? Because you
okay.
don't have the time to examine
Mm,
all these systems. If you have good time, okay, but I don't think you can cover all this stuff because the steps takes time. Here you are saying,
mhm.
"Yeah, I would like to do so, I would like to do so," but in the exam,
Yes.
be sure that at least at least 6 minutes to cover all the things, apart from the 2 minutes of consent. Let's continue. The other system that can help me or help us to consider finding the eye, the vision issue. You didn't ask about vision, right? You ask at the
I,
end.
yeah,
Yes,
yeah,
I'm talking
during the
particular.
examination.
Yeah, during the examination. Again, you are talking about during examination. But if you don't do examination, you might miss all these systems. I'm talking about
Ah,
vision. Okay, the vision here is very important. If you have any vision issue, maybe
yes.
related to the stroke as well. So you have to ask about the driving. You ask already, right? You ask about driving,
Yes,
right?
sir. Yes, sir.
Yeah,
Driving, I asked.
which
I
is
was.
good to remember, but put it in your mind always to ask about these things in the history as a systemic review question. Next question will be for the difficult swallowing. Again, it's related to the neurological issue. The
Mm,
next system will be cardiovascular, any chest pain, awareness of heartbeat. Here also is important. And the endocrine, you can ask also about any weather preferences. You didn't ask about the constitutional symptoms, which is also very important earlier question. Why? You could conclude this case would be space occupying lesion, right? You mentioned it.
mm.
So how you can say this the evidence of space occupying lesion in this scenario?
Vomiting, nausea, or any, like, you know,
Yeah,
meningeal
either
irritation, headache.
alarming headache, or
Yes.
neck stiffness, or constitutional symptoms. Patient is having weight loss or
Wait.
night
Yes.
sweat or fever.
Yes.
Back to the other systemic review question, short of breath. Maybe you are talking about
Mm,
TB, meningitis, TB, uh,
mhm,
space occupying lesion also can be related to the TB. So we have to consider all these things as a systemic review. Why I'm focusing on the systemic review? Because if you will not do examination, at
mm.
least you ask these questions in the history. Okay, you cannot cover all
Okay.
system in the exam. Be sure that you cannot do the cardiac plus
Mm,
neurological, the tone, power reflexes, and the speech and swallowing. All these things it will take time. The next system, very important here also, the GI. Any change of the GI or discomfort. It's not relevant, but you have to ask about any GI or any tummy pain, tummy distension.
Yeah.
What's important here in this scenario, the genitourinary, the urinary system question.
Yeah, bowel and bladder. Yes.
Yeah, the bladder. Yeah, you mentioned also the bowel, but the bladder here, as what could get from the bladder or from the genitourinary question can
Yeah.
help you.
Yeah,
What you
leaking.
think?
If it is on the prefrontal gyrus, if the stroke is over there, then he can have the loss of sphincter, and he can say that I am losing urine, like my bladder is not controlled.
Yes, this is as a manifestation. What about the
Yes.
pathology, pathophysiology of the disease? Anything in the water work can help you to diagnose or to say this is related to condition in the and urinary system.
Uh, as in what, Dr. Basil?
What if
Like
this patient having early morning dark urine? What do you think the case will be?
it will be PNH, right? Paroxysmal nocturnal
Exactly.
hemoglobin.
You will not get
Oh
it.
yes, it will also
Yeah.
get. Yeah, it will
Yeah.
also
So you will not get it.
hypercoagulate.
Yeah,
Yes,
hypercoagulable state. You are
yes.
talking about stroke, either thrombotic or embolic state. So you
Mm-hmm.
have to know what condition you have. You are diagnosing stroke not only by imaging and investigation. You have to know what the cause. Okay. So the underlying cause you have to know from your history taking. At least to
Mm-hmm.
have a clue. Okay.
Yes. Uh, Sir, Dr. Henry said the pregnancy loss thing, because when I was asking about this abortion, so for this antiphospholipid syndrome,
Yes, this
when
is one of the questions. Yes.
yeah, one of the when the patient said that I did not had any abortion, so I dropped to my
Mhm.
asking, because Dr. Henry said that the patient delivered. Now I should have asked that any losses of the child, like the.
Yes, you have to, particularly with the vasculitis. You have a rash in the legs. What you call this
Mhm.
rash, by the way?
Yeah, reticular right now is not coming to my mind.
Yeah, anyone can write it in the chat
Dr.
box.
Henry just told as well.
So he told, okay, so this is livido reticularis,
Yeah,
and
libido
it's
reticularis. Yes,
yeah,
reticular
and it's
rash.
commonly
Yes.
appear with vasculitis, right?
Yes, sir.
So you
Yes.
have to know other manifestation or other association of autoimmune. Here in this scenario, you might have antiphospholipid antibodies syndrome
Mm-hmm.
in particular, but
Mm-hmm.
it's not necessary. I mean,
Mm-hmm.
not necessary to have coagulable state related to antiphospholipid only. Some cases
Mm-hmm.
came as paroxysmal nocturnal hemoglobinuria. Some cases
Mm-hmm.
came as BHCT. Some cases
Mm-hmm.
came as other hypercoagulable like factor Leiden. So don't
Mm-hmm.
consider only the antiphospholipid syndrome. You have to screen all the other hypercoagulable states. Okay, polycythemia rubra vera came before in
CVR,
basis.
yes. Yes, sir.
Okay,
Uh,
so
s-
let's go back to the
mhm.
system review. It's very important. Musculoskeletal, he didn't ask at all. Any
Yeah,
joint pain, any
no
skin
joint
rash,
pain.
yeah, any muscle pain. Also, this is conclusive for autoimmune or connective tissue disease.
Rheumatologically, yes.
Okay.
But when I saw, sir, if I did not ask, but I saw it, so
If you saw
uh,
vasculitis or livido recturalis,
yes. So uh, will it not be like I know it, like?
no, no. In this case, you have to rule out antiphospholipid antibodies syndrome.
Mm-hmm, mm-hmm.
Okay. But I
Okay.
mean, other cases, it might be other
Mm.
pathophysiology,
Yes, sir.
like what I mentioned earlier.
Mm-hmm.
Okay.
Yes.
Usually, they bring such young patients with
Mm-hmm.
hypercoagulable state rather than saying this is atherosclerosis. You cannot say
Mm.
this is atherosclerosis, right?
Mm-hmm, mm-hmm. Yes, yeah, very young, 43. Uh, but then very young, 43, and hypertension.
So it could be other secondary hypertension.
Yeah, you didn't
Okay.
ask about the family history. You didn't ask the family history.
Yes.
You did not ask
Yeah,
family
yeah,
history.
that's also, yes. Dr.
You didn't
Henry,
ask.
thank you
Yeah.
for bringing it up. Yes, the family history
Yeah.
was missed out. Yes. Yeah,
Don't
family.
forget Takayasu also present with early stage or early or young age hypertension. Takayasu.
Mm. Yes, Takayasu, yes.
Yeah, this is what I
Taka.
want to say. You have to cover the system review. Don't ignore it. Believe me, you will they will minus you, and the mark will be minus in this as a clinical communication skill.
Yeah,
Plus, you will not get the case.
yes, I was just the reason, the timing is the
No, no,
thing
it's
I was.
no. It's easy.
So,
Every system one question to
mhm.
cover this system. The commonest question.
Okay, okay, yes, the bladder was missed out very, this was
Exactly.
not good.
Not
And
only
yeah,
that, please cover all. Even
yeah.
awareness of heartbeat. Awareness of heartbeats here, you can consider the AF as a pathophysiology of the stroke.
Mm.
Not only that, the hyperthyroidism. Any intolerance to any weather for hyperthyroid state, and the
Uh,
patient will be associated with AF,
yes, 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 AF patient will have hypercoagulable state, yes, sir.
right? Okay.
Yes, sir. And
Otherwise, yeah, you try to cover everything, but believe me, if you miss the systemic review, you cannot get the cause of the stroke. In the differential, you are saying stroke only, or stroke
mm,
and vasculitis. Don't forget to mention the hemorrhagic stroke. So you have to say, I have two types of stroke, hemorrhagic and ischemic.
yes,
Okay.
yes, sir.
And other than that, you can mention the other causes, as you said, vasculitis.
Mm-hmm.
And you can
And
say the other as multiple sclerosis and space occupying lesion. Multiple sclerosis also can fit this case as a differential
yes,
because
sir.
it's upper motor neuron lesion, right?
Yes.
Yes,
Yes. Yes.
yes. Yes, sir.
Okay.
Of course, it can.
Okay. Thank you, Dr.
Uh,
Aisha. You
uh,
have any
uh,
question?
yes, Doctor Basim. Because you see, when I was trying to explain my patient the concern, and I fumbled with the explanation, like how
Yeah.
in the normal term, how.
Mention it in medical term first. I have possibility of what you have. Possibly you have a stroke. Then mention
Okay.
the cause of stroke. It's a block or a blood clot in the blood channel of your brain,
Mm-hmm.
and maybe related to either increase or misdirection of your defense system attacking your
Okay.
body, or it
Mm-hmm.
could be related to other condition like hypercoagulable state. Don't bother about the name. Hypercoagulable state means your blood very thick and very easy to have a clot inside one of your blood channel in the brain. Okay.
Okay. Okay.
Yeah,
Yeah,
this is the
yeah.
way. Yeah.
This part,
So
anytime when I'm practicing, this part is the one which is making me very nervous, and that's
yeah,
why communication.
yeah,
Um.
this is the way how to consider or to explain the medical term, or to start first mentioning the medical term, later
Mm,
on explain it in simple way, as I said.
mm-hmm.
Okay.
Okay.
Yeah,
Okay.
please post your scenario for Dr. Henry.
I did.
You did. Let's
Yes,
read
sir.
the scenario. Where is it?
I've not seen
Uh.
it.
It's there. No,
No, not
it
yet.
was. Okay.
Yeah,
Okay.
45
Here.
years old female with irritability and anxiety post-viral illness.
Okay.
Okay,
Uh,
2 minutes. Then we'll start
yeah.
to. I'll try to read the comments quickly. As I said, Dr. Aisha, whenever you are mentioning investigation, start general, bedside, specific bedside, and
Mm-hmm.
imaging, and end by invasive tests. Okay, by
Yes.
this way, you will mention everything. Even here, bedside test you can do ECG, echo, Holter. If you suspect, for example,
Yeah,
the
PFO or something.
yeah,
Yes, or
and
valvular
general
issue.
investigation here, the coagulation profile is very important to mention them. Why? Because it consider as hypercoagulable. You might have change in the clotting or hypercoagulable state. Apart from that, The vasculitis workup here it considered as specific investigation as well. Bedside
Mm-hmm.
tests also can mention urine dipstick, as I said, also the echo ECG Holter,
Mm-hmm.
Doppler ultrasound, carotid, and also thyroid function here is very important to mention.
Yes, I did mention thyroid
So
function.
if you start categorizing your answer in this way, you
Yes.
remember everything, every simple and single investigation. But if you start to mention randomly, you will forget
Mm-hmm.
a lot of the investigation. The
Oh,
imaging here of a choice after three
mm-hmm.
days, what do you think?
MRI will be the
Yeah,
investigation of
MRI
choice.
most diagnostic one will be very sensitive and it will be very conclusive. But if you want to
MRA also.
start, yeah, everything, yes, you can do. Initially, if the patient
Yes.
presented in acute state, what
CT.
imaging
CT.
exactly?
Yeah.
Plain CT to
Yeah.
rule
Plain
out,
CT. Any bleed.
exactly. So to rule
Mm.
out intracranial hemorrhage. And
Yes.
if you don't have, you can consider it as acute stroke,
Yes.
I mean ischemic stroke, and you can consider the CT angio and
Mm-hmm.
always mention the multidisciplinary in
Mm-hmm.
order to be in the window.
Mm-hmm.
Okay, so you can give
Mm-hmm.
thrombolytic.
Yes. Yes. Yeah.
Oh,
Sir,
yes.
the vasculitis workup, like when I have to say, like when I present, so can I just get done with saying that I will be doing the workup for the vasculitis, or I have to go down with every vasculitis, or
He will ask you if he needs. The
oh,
examiner needs you to mention. He will ask you, "What do
okay.
you know, doctor? What's the vasculitis workup you know?" So you can
Mm-hmm.
start from anti-nuclear antibody till the
Mm-hmm.
anti-Smith, the specific for every single autoimmune disease. So C ANCA,
Mm-hmm.
P ANCA, if you want to mention, or
Mm-hmm.
the anti-double strain for systemic
SLA.
lupus,
Mm-hmm.
yeah, SLE, antiphospholipid antibody. He might ask you in details these three antibodies.
For APLA, right?
Yeah,
Anticardiolipin, beta
perfect. Yeah.
glycoprotein. Yeah. Sir, one more thing.
Mm.
When I'm explaining to the examiner, like
Yeah.
the disease, like I said, PNH.
Yeah.
So, will that be okay, or I have to say paroxysmal nocturnal
Better
hemoglobinuria?
to mention the disease in full term. And don't
Okay,
forget, you remind me about very important testing for paroxysmal nocturnal hemoglobinuria. What do you think?
PNH. Yeah, it's the early morning urine. Right now,
So
forgot.
urine
Uh,
analysis and so on. What's specific for
um,
PNH?
all right. It is CD59 and CD. There's the CD markers are there, right? And 50,
Yeah.
59 and is it
Is it
57?
50, 55 and 50? Yeah, 55 and 59.
59, yes, 50. Yeah,
Yes.
yes, yeah,
Okay,
59
and
and
one more.
one more. Mm,
Flow cytometry is genetic testing is very important. It's one of the autosomal
yes,
dominant, right?
yes, sir. Yeah, yes,
So I have to
genetics.
mention yes. And apart from that, you have to ask about family history. I'm not sure if you ask the question of family
The
history.
family was really missed out, sir. Family history, yes, family history and planar genetics.
Okay.
Yes.
Perfect. Otherwise, Dr. Aisha, any question before starting the next scenario?
For now, it's
Okay.
okay.
Quickly, I will read the comment, Dr. MRCP basis. Don't miss MS in any young patient. We mentioned it in the differential previous vision problem recovery period. So yes, you can ask about any previous attack. This is good question by Dr. Aisha. Is it first time or you have it before? Not only in this scenario, in any scenario. Whenever you have acute presentation, you have to ask about when exactly started, onset course duration, any previous attack. One question also here. Yeah, Dr. Abdel Alauddin, stroke, TIA, multiple sclerosis, brain speculation, muscle weakness, myasthenia, Lambert-Eaton as a differential, systemic review, ECG-AF. The management part shouldn't this patient be admitted instead of monitoring follow-up appointment? Yes, very good question.
Yes, yes, yeah,
Very good question.
yeah. How will you
Yeah.
manage? Yes, I will manage him in at the hospital. Yes.
So
Uh,
how we can do? Is it initial admission or acute
yeah, it's an
admission,
acute case. I will not let the
or
patient.
is it the referral within 24-hour urgent referral? What do you
It's
think?
it is an urgent referral, sir, and he will be hospitalized because it is 3 days and he's still in the window that we
It's not
could
window. He already passed the window. But the point here
the
is
retraction could have been done.
the point here is you don't know how much the weakness affecting his airway. So the best answer, I will
Mm-hmm,
refer this patient to the assigned team and they will decide. So I will admit this patient to
mm-hmm,
do the workup after the initial assessment. I will call for multidisciplinary team. They will decide if he needs admission or just referral. Don't be judgmental that I will admit or I will discharge, particularly the discharge. Okay, if you can admit any patient,
mm-hmm,
then to be reassessed, but don't say I will discharge this patient upon your responsibility. Okay,
mm-hmm,
so you have to refer to the
mm-hmm,
assigned team who can discharge or admit him if you are not sure about the criteria of admission of this patient. So the best way, I will call the neurology to
mm-hmm.
assess him, particularly the speech and language therapy team. This patient might go home. If you want to send him home, he might have either progression of the stroke or he might have aspiration because of the swallowing deficiency. So be safe, refer the patient rather than discharging him or saying I will refer him to clinic. Okay, the best way is to call the doctor, the neurology,
Mm-hmm.
along with the other team to assess and to decide either for admission or for discharge. Yes, Dr. MRCB mentioned the sickle cell as a cause of stroke. Yes, it's very
Yes.
important. You will have history of blood transfusion. You will have history of family history. I mean, and
Mm.
he might be or she might be anemic. Okay, well done. Thank you for the good discussion. The name of the patient, Dr. Aisha. So you can
Mm.
mention Julia Smith as usual.
Yes,
Dr.
Julia.
Dr.
Yes.
Aisha, Dr. Hinabi. Ready?
Okay, Julia Smith, noted,
Julia
sir.
Smith. Okay,
Yeah.
here you go.
Okay.
You-
Hello,
Hello there.
I'm Dr. Henry, one of the doctors here. May I
Mm-hmm.
confirm you are Miss Julia Smith, 49 years old?
Yes, I am.
Okay, please submit you. Actually, I'll be seeing you today, asking
Mm-hmm.
some questions, then examining you. In the course of
Mm-hmm.
my, seeing you, if you have any cause to ask question, feel free to ask me. Is that okay?
Mm-hmm. Yeah, that's all right.
Right. I just go through your note. Can you tell me what brings you to the clinic this morning?
Yeah, yeah, doctor. I'm not feeling too good. I just feel too worried about everything as if like something is wrong with me. I'm not feeling good.
Mm. Oh, I can imagine how you feel. Not to worry, we'll see how we can help you. Is that okay?
Mm-hmm.
Okay. Is how did can you tell me how your condition started?
Yeah, I mean, the past 2 weeks ago, I had this sore throat. I was not feeling too good. And right, like the usual remedies, I took some home remedy of hot water and chicken soup, and I started feeling well. After that, after that, I just started that I'm nervous. I'm just nervous, and I'm not feeling good. I feel like
Mm.
something terrible is
So
going to happen.
I can imagine. So sorry about that.
Mhm.
Can you tell me outside the so you feel nervous and you feel very anxious? Is that not?
Yeah.
Okay. Do you
Yes.
also have, okay. For how long now? You having this feeling of anxiousness and you know nervous? For how long now?
It has been two weeks. Yes,
2 weeks. Okay.
already.
Is it
Yes,
getting
and it's
is it getting worse or it's remaining the same?
I don't know the nervousness is getting worse or not, but it is just happening from past. I just feel that everything is going wrong now.
I
I just don't
understand.
feel good. I'm anxious about everything.
Okay. Any movement of the hands or mouth or any part of the body rationally?
I'm just dropping things. I just feel that maybe and that's also making me very nervous that things are not going right. Yeah.
I can imagine. What of your tongue? Any movements of your tongue in any, in an abnormal way?
No, no, I
Okay. What
haven't
of your eyes?
noticed.
Does your eye do your eye rotate in an abnormal way too?
No, no, I haven't noticed something like that.
Okay, even your hands too. Okay, but you drop things easily, right?
Yeah, yeah, I feel like it's shaking.
Okay. May I know the if you take any maybe medication for the sore throat you had, any medication at all you took outside the warm water and soup?
No, no, no. I just took home remedies, some
Oh,
remedies like ginger and chicken soup and nothing else. No, no medications.
okay, okay. Do you have any past medical complaint previously outside of this sore throat?
No, I am quite a fit person. I take care of myself a lot. Yeah, no.
Okay. Have you had similar sore throats before in the past?
I have been sore throat many times in my childhood.
Oh,
Uh,
okay. So sorry about that. So sorry about that.
mm,
Do you have any headache?
no, not really.
No headache. Okay. Any confusion?
I maybe some confusion, some um, like sometimes I just feel that things are not very clear.
Okay. For how long now?
Same time, 2 weeks.
2 weeks. Okay. Any loss of consciousness?
No, no,
Okay. Any blurring of vision?
no,
Have you had any fits or seizures?
no,
Okay. Any problem with your sense of smell?
no,
Any problem with your vision, like blurring of vision? No.
no, no. I
Okay.
haven't noticed.
Okay. Out of your mouth, any sores in your mouth?
No,
Any neck swelling?
I just feel that maybe because of that sore throat. Maybe you can check and see later.
Okay. 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 Can I see your neck if there's any neck swelling? Any neck
Yeah,
swelling?
yeah. It's just tender.
Just it's tender.
Yeah.
Okay. And any okay. So sorry about that. Have you had this neck swelling before in the past?
No, this is the first time after, and that too after this infection that I had.
Okay. Okay. Any raising of your heart?
Yeah, when I'm sleeping, I just feel that, my heartbeat is going very fast. But when I get
Very
up, I'm
fast.
like, I just feel maybe I'm thinking about it too much.
Okay. Okay. Do you have any cough?
No, no, no cough now.
Any shortness of breath?
No.
Okay. Any loose stool?
Yeah, I'm going to the toilet too much. Yeah, I have a
Okay.
very bad diarrhea from past some days.
Okay. So sorry about that. But at night too, do you have the diet when you does it wake you up from sleep too?
I think once or twice, not really.
Okay. Okay. Any blood stain?
No,
Okay. And any accompanying, let's say, feeling as if you've not had enough of stool.
no, no, I don't.
Okay. Okay. Do you have any have you any feeling sick? Do you sometimes feel sick and throw up?
No,
Okay. All right. Any joint pain?
no,
Any skin rash?
no, no. I haven't noticed anything, I must
Okay.
say.
Okay. Any lumps and bumps?
Other than this throat,
Okay.
you have
Yeah.
to check.
Okay. Okay. Any problem with your water work?
No,
Okay. You don't urinate frequently. Okay. Any change in skin coloration?
no,
Have you feel as if you've okay? Do you have any past? Have you done any surgery before in the past?
huh? No surgeries, no
Okay.
surgeries.
Okay. Any family history of similar condition?
Yeah, my mom has thyroid problem. Yeah. Hmm.
Okay. So sorry. I she now she's getting better.
She's on medications, but she
Okay.
she just have thyroid. Yeah.
Okay. If I may ask, sorry, have you had any recent hospitalization,
No,
blood transfusion?
no.
Do you smoke?
I do smoke.
Okay. How many sticks of cigarette do you smoke per day, and
Maybe
for how long?
I've been smoking for now 10 years, and it has been like 3 packs of cigarette, roughly.
Okay, I think at this junction you may need to. Have you ever thought of stop smoking?
Yeah, but I cannot do it.
Okay, I think how about that if I refer you to a smoking cessation clinic? How about that?
That would be a good idea. Yes, thank you.
Okay, thank you. Okay, do you drive?
I do drive. Yes.
Okay, and currently you are not having any problem with your vision, right? Okay, do you have any? Do you take alcohol?
I do drink. Yes.
Okay, how often do you drink?
Oh, very occasionally. Like
Okay, but you don't binge drink, right?
no.
Okay. All right. Are you staying with your partner?
Yes,
Okay. Are you? Do you have any? Sorry, this is how is this condition? How is it affecting your family life and your personal life?
it is affecting me big time. I'm just not myself. I'm very upset on everything. I'm just
Okay.
feeling that I'm not going to have my life back.
Not to worry. We'll see how we can help you. We'll involve our
Thanks,
social
doctor.
services. Okay. And if I may ask also, do you have any recent travel?
No, not really.
Okay. Are you on
I'm
any
just
medication?
close like no,
No medication. No party drugs.
no,
Okay. Do you have any history of any use of pills like oral contraceptive pills you take?
no. I don't take
OCPs.
any.
Okay. What's of your
No.
how's your menses like? Are you still menstruating?
Yeah, this time it was horrible. This time was not good. It was very heavy, but yeah,
Okay. So sorry about that. Okay. Have you had what of your pregnancy? How many children do you have?
I have 2 kids.
Okay. Any pregnancy events like
No,
pregnancy loss
no,
or okay. All right. At this point in time, do you mind if I examine you?
sure.
Okay. First of all, I want to start by looking at your hands and see your hands.
Hmm.
Check for tremor, any fine tremor,
Yes.
any yes tremor, right?
Hmm.
Then look at the sorry if do you have any weight loss?
People are saying that, and I do feel that my clothes are like a bit looser than before.
Okay, all right, okay. Do you how's your appetite like? Is it okay?
Who? What? Sorry.
Your appetite.
Appetite? Yeah, my
Mm,
appetite. Yeah, because of this diarrhea, I'm worried to eat. But yeah, I do feel that I'm eating. But
okay, okay.
yeah, yeah.
Do you feel as if your temperature is getting hotter? Is
I feel
increasing? Your
warm
body
most of the times.
is
Yes.
okay. All right. For how long now? The same 2 weeks, right?
Yes.
Okay. If I may ask, so I touch I want to feel your palm, check for the moist, if the palm is moist, check for the
Mm-hmm.
tremor, check for any finger clubbing,
No clubbing.
or check for the pulse rate. How is the pulse rate like? Any atrial fibrillation, any irregular pulse? Is the pulse irregular?
The pulse is you could feel it's tachycardic, like it's.
Tachycardic. Okay. Then check for the regularity and everything. Check for the BP on standing and sitting. How is the BP like?
No need to check the BP, but yeah, the
Okay.
BP is yeah.
Okay. Then look at the neck. Check for feel, palpate it. Check ask him to protrude his tongue. Check to then give him water to swallow. You check
Mm-hmm.
and see if there's if the swelling.
No,
Can I
doctor,
see the
it's
neck?
very painful. Don't
Okay,
touch
very
it.
painful. Okay. Okay. Can I see the picture? Okay.
No,
Then
there's no
go to
picture. There's no
okay.
changes. Don't worry.
Okay,
There's no changes yet.
then go to the
It's
back and then check, palpate, check for the lymph nodes, palpate the since it's painful, I will not touch it that much. Then check
yeah.
for retrosternal extension. Then check check for auscultate for palpate for brew. Sorry, auscultate for the brew. Then go for in front. Check, look at the head. Check for any skin changes in the head. Look at the eyes. Do the H sign. For check for
Mm.
lead lag and lead distraction.
Yes,
Any
there
lead lag.
is.
Okay. Then check for ophthalmoplegia. Look at the eyes. Check for the 4H sign and see any ophthalmoplegia.
No ophthalmoplegia,
Okay.
but yes, there is
Okay.
lid lag.
Okay. Then ask him to sit up and check for proximal myopathy. Any proximal myopathy, any weakness. Then
Mm,
then check at no proximal myopathy, any proximal
Why?
weakness.
Like, are you going to check or are you asking me?
No, I'm going to check. Yeah, can you do pronator drift? Then stand up from sitting position and see if there's any
No,
weakness in
everything's
standing up.
okay. No
Okay, then
proximal muscle weak.
check for the leg for pretia myxedema. Any pretia myxedema?
No, but there is some red spots.
Okay. All right. Okay. Do you have any concern?
What's happening with me? Am I
Okay,
going to die?
2 minutes left.
That's a good question, if I may ask. Actually, what you are what you are having is a condition in which we call as we call it decreased thyroiditis. Is a the medical word, don't mind the grammar. It's a condition whereby is the fluid you had previously tends to trigger an your defense mechanism to react, and that's why you're having this painful neck swelling. And not to worry, it has it run its course. However, at this point in time, we need to give you some medication to decrease the heart rate and to a painkiller that will also stop the pain from going down. Then we'll do some blood tests to see some other some to also rule out if it could be a problem that has to do with your what you call other things that we are thinking of that also affect your immunity. Then we'll also do those things too. And then basically we may need to refer you to a gland doctor that will subsequently take care of you, and then follow up from there. We'll do a next scan too, we'll scan your neck, and then we'll continue from that. How about that? Do you have any other
Makes
concern?
sense. Yeah.
Any other
So
concern?
yeah, the other concern is can I join my work because I work and I have a very I can't take leaves from there.
Yeah, at this point in time, that's we may need to give you a note because you may need rest to allow we need to rest for a while we treat you. But we're not at this point in time, we may need to give you a written document to your employee, and then we have also talk about you need to stop smoking now because smoking tends to worsen the condition too. And at this time, yeah, we should need to stop smoking. Then we write letter to your employee. How about that? Is that okay?
Yeah, this makes sense. Yes.
And any other concern?
No, that's it. Thank you, sir.
All right, thank you very much.
All
All right, so I wash my hand and then fix my examiner.
Thank you so much.
Okay.
All right. So well done, Dr. Henry. You did very good. And
Okay, the
I
examiner
think
question, Dr. Henry, Dr.
yes,
Aisha first.
yes. So the diagnosis was quite clear. So what are the other examinations that you want to do in this patient from the physical to the blood work? What specific examinations you want to do, and what different types of as you noticed that is a thyroiditis, yeah? What other types of thyroiditis you know?
And the type of thyroiditis I know, maybe
Or hyperthyroid conditions, you know?
hyperthyroid, yeah, it is maybe diffuse multinodular goiter, which is Graves' disease. Maybe it may be also multinodular goiter, which is it could also be due to an adenoma, a thyroid adenoma. It could also be due to drug-induced thyroiditis, like amiodarone-induced thyroiditis. It could be due to which have several type 1, type 2. It could also be due to like other than the decreased thyroiditis, that he has. It could also be due to autoimmune thyroiditis too.
Autoimmune thyroiditis is Graves' disease, yeah?
Pardon? Autoimmune thyroiditis, yes. We have autoimmune thyroiditis. Graves' disease is not autoimmune thyroiditis. They're quite different.
Hashimoto and Graves are.
Yeah, Hashimoto has a
hypo.
Hypo, yeah. Initially hyper, but later becomes hypo. Hashimoto, yeah. So typically, Graves is the diffuse multinodular goiter. That is also an autoimmune too, but it's not typical. It's also autoimmune, yeah. Can you say autoimmune? So these are the other cause of yeah.
Okay, so according to your symptoms, what other symptoms would you expect in this patient as a hyperthyroid condition?
The other symptoms that I expect in this patient may include the heart, which is a palpitation like the patient presents, also the diarrhea that she had, also then the autonomic features, like I put, it could be autonomic features, it could be due to also visual symptoms, it could also have also visual symptoms, and then feeding symptoms too, problem with feeding, and then reproductive symptoms too, menstrual problem like he has, like in this case he has menstrual problem too. Basically, it could also have I think these are the common problems that is seen
Okay.
in thyroid
Okay. So
hyperthyroidism.
what lab abnormalities do you think that if it's a hyperthyroid condition, what lab abnormalities we can get?
Yeah, lab abnormality I can get hyperthyroidism may include elevated T3 and T4, and then low TSH. And basically, other lab includes may have blood, full blood counts and differential liver function test, and then the ultrasound they may have
So
diffuse
what in the
midline.
liver? What in the liver you want to say?
In the liver,
What about the electrolytes?
the electrolyte too may be affected. Yes, they may have this electrolytemia. They may have
What specific electrolyte that we are worried about that could be elevated here?
yeah. In this
Which could be
case,
a
yeah,
in this case or any hyperthyroid case?
any hyperthyroid case, electrolytes that we are concerned about typically the potassium and also the potassium and the calcium. Basically, that the two electrolytes we have.
Why do
And
you say potassium? Why do you say potassium?
typically, because of it is an hyper anabolic state. Is a hyper metabolic state.
Mm.
It tends to have hyperkalemia alongside because the cell is continually in use, continually being used. So they tend to have high potassium, and then yes, basically that's what I just reason it out. I'm not so sure. I'm not so sure though. Basically,
Okay.
yeah.
So Dr. Basim, I should not comment now. I should do it later, right?
Yeah, you have still 15 seconds.
Like
Did you
I should
mention
not
the
comment.
management?
I should not comment on anything right now. I should comment it at the
Yeah,
end.
yeah.
Yeah.
After finishing 5-minute
Okay.
examination,
So so you
management
said
plan and
yeah.
differential. He mentioned.
Yeah, differentials. Yeah, he already mentioned the different types of thyroid. What are the differentials you want to mention other than thyroiditis in this condition?
Other than thyroiditis, it could be Graves in this condition. It could be Graves. It could be thyroid it could be toxic multinodular goiter. In this case, it could also be the although since it's not pregnant, and it could also be peripartum. What they
Thyroiditis.
yeah, thyroiditis basically. This is a
Any
female.
other the disease that has similar condition other
Any
than
other
thyroid?
that yes, it could be due to since he had because of the feeling of anxiety and anxiety and what do you call it again? The agitation that he has. It could be due to maybe post, how do they call it again? There's this condition post, it
Proximal.
could be kind of, it's
Oh,
more like a post, how do they call this? Like, I don't know. Yeah, I don't know. I can't just, I don't
what do
know.
you want to say?
Like
Okay,
it's some condition that can
but
follow some.
you checked me for proximal muscle weakness. That was somewhere you wanted to think something.
Yes,
What was
yes.
it? PMR? You were thinking about polymyalgia rheumatica?
Yes, it can still be a polymandial rheumatica. Yeah, could be.
Okay. Okay. All right. Then how will you manage this patient and yeah, your investigation?
Yeah, investigation will include the thyroid function test, which I expect to see the TSH, T3 and T4, and then I want to do the next scan of the ultrasound scan of the neck, and then the uptake thyroid uptake scan,
Mm-hmm.
and then I
Radioactive.
want to do radioactive uptake scan. Then I want to do antibody tests such as TPO, TSI, and thyroid
Mm-hmm.
stimulating hormone antiglobulin. And
Mm-hmm.
then I want to do liver function tests, full blood counts and differentials. And
Mm-hmm.
then also other antibodies just like also ANA2. Then full blood count differential. Then random blood sugar. In this case, I want to do.
Mm-hmm.
Then basically, I want to also to do C-reactive protein and ESRO.
What?
Now, C-reactive protein and ESRO. ESRO.
CRP. Okay.
Yes,
Mm-hmm.
ESRO. Then as per other, these are the major investigations I want to do for my patients. And then I want to do ECG, basically because of the heart rate ECG.
Mm-hmm.
Then check the ECG, chest X-ray to rule out
Mm-hmm.
other cardiac manifestation, and also
Mm-hmm.
do an echocardiography. Then for the management, so in this case, we want to start by the management will involve multidisciplinary team approach
Mm-hmm.
involving the endocrinologist, the
Mm-hmm.
specialized nurse, the
Mm-hmm.
occupational therapy, yes, basically. And then we want to counsel this patient on the disease condition, smoking cessation, some smoking cessation. Then we want to start him on beta blockers such as propranolol, and
Mm-hmm.
then propranolol basically, and then I'll counsel him that this disease condition is it will follow a course. After this phase, we are supposed to see a phase of low thyroid, and then it will go. Then place him because of the pain. I want to start placing him on analgesic,
Mm-hmm.
analgesic like any NSAID like ibuprofen or naloxone,
Mm-hmm.
depending on if you can tolerate it.
What
Basically,
did you say? Naloxone?
no, as either ibuprofen, one of the
Mm-hmm.
NSAID or
Aha.
for the NSAID like ibuprofen.
Mm-hmm.
Basically. Then if there's no contraindication in this case, we have to
Mm-hmm.
start him on that. And then if there's
Specific hyperthyroid.
but if there's indication is people with Graves disease that are managed as Graves disease. But in this case, it's more like viral. It is more like sub what do you call it? Subacute
Thyroiditis.
thyroiditis. Yeah,
Yes.
basically.
Okay. All right. I think yeah, you did well, Dr. Henry.
Yeah, you can comment now, Dr. Aisha. Very
Yes.
good.
Somewhere like I'm not very expert, so I just feel that somewhere you missed out on some things like the smoking was you just asked and you touched and you went and then you did not even like we will make an appointment or something, and the alcohol history was also not asked properly. The main thing the one that was holding me like when you were talking about atrial fibrillation, your treatment one, you did not do anything about the atrial fibrillation management or workup for it. Is there any is there anything that you want to treat me for this fibrillation? And
Okay.
I think you've covered most of the thing. I think Dr. Basim will be the one who can tell
Okay.
more better than I can. For me, I think you did very well. I mean,
So
yes,
it's a case of Dickervan or subacute thyroiditis, right?
yes, sir. Yes, sir.
Straightforward. I think it's clear since the complaint. You can know it from the complaint.
Yes, sir.
Post-viral, patient had anxiety.
Yes.
Okay. Thank you, Dr. Aisha, for the case. I will ask Dr. Henry specifically inflammatory markers, what you want to do, apart from CRP and procals.
Yeah. If inflammatory markers,
Yeah.
I mentioned I also want to do the thyroid antibody test, although that these are not inflammatory markers too, like TPOs and then thyroid TSI and TSH,
I mentioned,
immunoglobulin.
yeah, as inflammatory, not antibodies.
Okay, as inflammatory markers, yes. For the I want
It's
to do
advanced one. It's advanced
yeah.
one, not in
Okay.
all hospitals, but it's helpful. It's helpful. It
Okay.
can help to diagnose, and it will be consumed and or will be low. What do you think? These inflammatory markers, not high.
Is it fibrinogen?
No.
Mm.
I don't ferritin. No,
Mm.
I can I
Ferritin
can't.
is
Do
an
you know?
acute phase protein. Yes, B12 can also be. These
No,
are the
no,
acute.
something else. Do you know about the interleukin 6?
IL-6,
Yes,
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 yes, yeah,
IL-6,
yes.
yes,
Enough
Yeah.
IL-6.
yes,
Okay.
yeah,
This one's supposed to be low as a specific investigation, but
yeah.
it's
It's
not
used
available
to.
in all hospitals. Yeah.
Mm.
Okay. Let me comment now about the performance. What you miss at the system here, female history. Did you ask about the female pregnancy? I think you asked about pregnancy, right?
Mm.
Yeah, I did. I
Okay,
did.
what about previous pregnancy?
Yes, I did. I asked. I asked.
Delivery, the child, the children age.
No, no, I did not. I did
No,
not ask
no.
about the children.
Yeah, what do
I
you
did
think the
not.
importance of this question?
Yes, yeah, it's important because the last major period is important because of it could be due to peri-
Yeah,
uh,
lots. Abortion also. Missed,
postpartum
missed.
thyroiditis.
Yes,
Yeah,
Post
postpartum. This is one of the your
postpartum.
differential, by the way, right?
Yeah,
yeah,
yeah, it is.
yes.
So
Yeah.
postpartum, autoimmune,
Mm,
and post-infection. These are the three differential of your case today.
yeah.
That's why you
Because
have to.
because
Yeah,
when I asked her, she said her last major period she had
Was very
excessive
bad.
was very bad. She has excessive bleeding. So that's why I now felt that it's unlikely to be due to postpartum. That's why I didn't really went for that. Since she said she saw a period last, it was
yeah.
it was
Okay,
kind
let's
of
take this take-home message.
Yes, yes.
okay.
Two cases. In cases, you have to ask about the delivery, last delivery, or three cases. Okay,
Mm-hmm.
let's mention them.
That's
The
true.
first one, any thyroid state or any
Mm-hmm.
thyroid change, hyper or hypo. So you have to ask about the last delivery, okay, or the
Okay.
last or youngest age of the children, youngest children age. Yeah,
Mm-hmm.
okay. The second case, peripartum cardiomyopathy.
Mm.
Mm.
Okay, and the
Oh,
third case, Sheehan syndrome.
She hands, yeah.
Yeah, so
Mm.
you have to ask about
Pituitary.
the delivery. Is it eventful? Anything happened? And when was the last delivery? So it will be clue for your case. Is it postpartum thyroiditis, peripartum cardiomyopathy, or Sheehan syndrome? According to the presentation complaint or the complaint or the presentation. I mean, if you have an anxiety, so no need to consider postpartum cardiomyopathy, peripartum cardiomyopathy. If you are short of breath, patient delivered 6 weeks or 6 months back, you can consider peripartum cardiomyopathy. If you have
Mm.
patient with
okay.
amenorrhea and you have history of delivery for last 1 year or 2 years, but the delivery was eventful, and the patient
Mm-hmm.
now presented with amenorrhea and
Mm-hmm.
failed to
She
lactate,
hands.
Sheehan syndrome.
Mm-hmm.
So these are the
Yes.
three conditions in cases you can say or you can ask about the delivery and is it eventful or related to your complaint.
Okay.
Okay.
Mm-hmm.
Otherwise, I think you cover the
Yeah.
other systemic review questions. The
Yeah.
weight loss here is very important. I don't
Yes.
know why. I prefer always to ask about the constitutional symptoms early. What do you think
Of
the
course.
age, the weight and appetite here will be affected,
Yeah.
Dr. Hilary?
Yes, yes, yes.
Yeah.
Yeah,
Because
yeah,
yeah,
yes.
if hyperthyroid state, the age, the patient will have good appetite and even
Loss of weight.
a loss of weight, or even
Wait, yes.
even high appetite.
Mm.
Okay,
Mm.
they are eating more. The awareness of heartbeat as the AF. Don't miss the examination.
Yes.
Always, whenever you hold the hand, examine the pulse. Make it a habit.
Yes.
Okay. The vital chart, doctor. I want to know the vital chart. See, in both scenarios, AF was or the pulse is very important to examine. In the first case scenario, for the stroke, and
Mm.
here again it could be AF. Both scenarios might be AF in your case, and if
Mm.
you couldn't check the pulse, you might miss the AF, right?
Yeah. Yes.
Yeah,
Yes.
I think the thyroid examination he did well, the eye examination as well, the vision, the driving, all the things supposed to be addressed. It's smoking. What do you
Yes.
think the smoking can aggravate in thyroid?
I know the ophthalmic Graves disease
Yeah,
or
Graves
ophthalmic.
disease. Yeah. So here, not only to advise, strongly advise,
Yes.
and a good way Dr. Henry mentioned, the patient should stop. And when she said no, I don't want, he asked her, or he recommended that we can refer you to a smoking cessation clinic. They can help you with good ways. So they are professional, they can do this easily. Okay.
Yes.
So whenever patient is refusing, you have to do so, as Dr. Henry says. So I refer you to some smoking cessation clinic. Okay, clear now for this part. Uh, yeah, apart from this, I think, yeah, the thyroid, the examination went good. The inspection, palpation, percussion, auscultation, all the steps you
Yeah.
have to do. Everything here you can do. So the auscultation for bereave, percussion for retrosternal extension, and the inspection for goiter, palpation for the gland consistency, and the diffuse or solitary or single or
Yeah. And
multiple, and the lymph
sorry, Dr.
nodes as
Basu.
palpitation. As palpation. Yes, Doctor
Yeah.
Aish.
He should have asked, Dr. Henry should have asked me before touching my neck. Yeah,
And,
that was the patient's welfare. He,
okay. So he
yeah,
asked
that
permission.
was,
Yeah,
he did not ask me. And yeah, that was one of the catch in this
yeah. Take care.
examination
This
as
is
well.
one. Yeah, yeah.
Yeah, that
It's
he,
important point. Instruction. I will be standing behind you. You will drink a sip of water. I will palpate. So
yeah.
don't worry. All these things you have
But
to
if it is
instruct.
hurting, like, because it is hurting, I said. And
Okay. There is pain. Okay.
yeah,
So
and
yeah, yeah.
he
Give
did not
instruction.
ask me before touching. So,
Yes, it's not only
yeah,
for thyroid, all the examination step. I am
y-
here to
Yeah.
examine you. If you have any pain, let me know. I'm so sorry if my hand are cold, and start examination. If she said hair pain, I have hair pain, I will try to be more gentle. If she
mm,
insists there is pain, could ask the examiner, will I continue or no?
yeah,
Okay,
yeah. This
don't
was the catch,
insist.
actually. This
Yeah,
was
good.
the,
Yeah, good
Mhm.
to say that. Yes, perfect. Okay, thank you, Dr. Aisha, for this case, and Dr. Henry as well. Anyone
Yes.
want to, or any question from any of you?
Mm.
Okay, Dr. Alauddin asked about the medication history, amiodarone, thyroxine, especially with family history of thyroid disease. Perfect.
Yeah.
Yes, you have to ask about any medication, any over-counter, and show me your medication list. Interferon as well, the biological therapy can cause also the same albuterol or
Mm.
inflammation, I mean. The other thing, iodine as also a cause of hyper or hypo iodine exposure,
Yeah.
or
Yeah.
Both.
iodine as iodine deficiency can cause hypo, or extra can cause hyper. So
Yeah.
you can
The
consider
patient's
it as,
mom has a hypothyroid.
yeah,
Is it
particularly if you have,
affectatious?
perfect. Is as the factitious, this is one. And the
Yeah.
second thing, maybe the whole village. Sometimes they will tell you, yes, or my village, or my city having a similar condition, or
Yeah.
my
You
family
also
having
take, yeah, yeah. They all have it in the same, yes,
iodine, is excess iodine.
yes. So yeah, factitious could be one of the differentials because mom is
Yeah,
having hypothyroid, and
yeah, and
maybe
she's taking the medication to lose weight. It comes before,
Yeah.
yes. It
That's true.
comes as,
That's true.
yes.
yeah.
Okay. Any other thing you want to add, Doctor? I think we covered the investigation well. So specific again, general, specific bedside, and imaging, and by invasive. What do you think the invasive here to do?
FNIC, if we
Exactly.
yeah,
FNA, fine needle aspiration.
yeah,
Non-invasive ultrasound or imaging ultrasound.
guided, yes,
Yes. And you
yes,
can consider CT for retrosternal extension.
yes,
The bedside test, you can say Holter, ECG, echo. Okay.
yes.
And for the specific, all antibodies you have to do. And inflammatory markers is very important. You have to mention them.
Mm,
Okay. What
mm,
else? The management plan according to the cause. So if the curvan, according to state of the thyroid, if hyper, you can give medication, or hypo, you can replace, or if no, or euthyroid, you can just give painkiller or non-steroidal, as Dr. Henry mentioned. So
mm,
it's considered as supportive or symptomatic treatment only. Okay.
okay.
Yeah, this
Yeah.
is in brief the topic. Anyone want to add any question or comment? Okay. Satisfied all, I think. So we'll thank Dr. Aisha, Dr. Hinari.
Thank you, sir.
Yeah, before ending the
Thank you.
session. Yeah, thank you, Dr. Aisha, Dr. Hinari. Thank you, everyone, for the attendance. See you tomorrow, inshallah, the communication day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Alaikum.